Hi, everyone. Welcome back to another episode of Ask a Care Manager. My name is Ryan Abrebsky. I'm the Director of Business Development, and I'm joined as always with Teresa Jackson, our Director of Care Management. The both of us work for EasyLiving. We're a home care and care management agency serving the Tampa Bay area for over 22 years. As always, the Ask a Care Manager video series is brought to you by our friends at the Senior Living Resource Magazine and their website, seniorlivingguide.com, your one-stop local and statewide resource for all things senior housing and health. Anything from assisted living to memory care to senior wellness, home care services like EasyLiving, and also care management services, again, like EasyLiving. And you can check out our new ad this month right here on page 80 for EasyLiving, talking about all the wonderful services that we offer. So check out the Senior Living Resource Magazine and their website, seniorlivingguide.com. And they will mail you an issue to your home. And especially with the new issue coming out, check that out today. So Teresa, welcome back.
Thank you.
As we continue our different themes for the month, I know most of this month we spent talking about nutrition, but we kind of wanted to pivot a little bit and identify a disease that we commonly come across in the home care and care management realm, and wanted to kind of promote some of their awareness. So that's multiple sclerosis. Hope I said that correctly, but as also known as MS. So the month of March is the MS Awareness Month. So I kind of wanted to talk about this disease because we commonly see this, these individuals typically needing some kind of supportive care services, unfortunately when they get diagnosed with this disease. And as we know, there's over 1 million estimated individuals over the age of 18 who are diagnosed with multiple sclerosis. So it definitely is something that affects obviously a significant amount of people. But, with supportive care services that I think, I would love for you to discuss how not only a care manager can help, but maybe some of the home care services can support those individuals as well.
Definitely. And again, the reason we have, or not we, but the reason there are these special months it's to bring education awareness to different diseases, illnesses, or just like, earlier this month, nutrition, different topics to increase public awareness. So I'm really glad. I do know I have a family member, and I also have a friend that they both have MS. It's not my area of expertise, but, I do want to share as much as I can about the illness. MS is a chronic disease of the central nervous system, and it causes problems in communication system between the brain and the body. That's probably a very simplistic way to explain what MS is all about.
And I just want to interrupt about that is if you guys check out our Instagram page, we put up a great visual way of understanding how the brain and the body function with MS. So with MS, in a normal body, there's just basically a wire that connects, and it's a perfectly fine wire. It's obviously connecting back and forth from whatever systems it's talking to. But someone with MS, it's the wire, but it's kind of frayed. And I know sometimes with our chargers, because of all the uses and stuff like that, you start seeing some of the wires frayed out. It still works, but it just, sometimes it can work better, sometimes it could work worse. So, check that visual. I think that was a great way. It, really made it sense to me of like how someone with MS is dealing with that.
Good. Thank you. Thank you for sharing that. It does help to have a really good visualization so you can understand an illness or a disease process better. And, unfortunately, MS can become progressively worse. So, it cannot be cured, but it can be managed with treatment. And, the impact that it has, in some cases it can be mild, and some it can be severe. Many with MS develop impairments such as vision loss, a lack of control over muscles, and at times some cognitive issues. So, anytime when you're looking at a situation that has cognitive issues or muscle loss, it's always good, especially if it's a severe situation, to have a care partner, to make sure, if someone needs assistance with activities of daily living, that additional support is there. Again, that just like with most neurological diseases, you're going to have good days and you're going to have bad days, but you always need to prepare for the worst day scenario. I know some of the common symptoms of MS would be like fatigue that worsens throughout the day, numbness in the body, face or hands, or face or legs, weakness in the muscles, especially the feet, bladder and bowel dysfunction. There's vision problems, which I already mentioned, dizziness, pain. Again, cognitive issues can be a difficulty. Depression, and even sexual dysfunction as well. And you think about all of those symptoms. This is why sometimes getting a proper diagnosis can be challenging. Mm-hmm. And if you don't have the proper diagnosis, you're not going to get the proper treatment. And this is where having a care manager come in and advocate for you to make sure that the doctor they are hearing what you're saying about your symptoms, and not just say, oh, well, you're older, this is normal aging. It's not normal aging. And, because like I said, a lot of the common symptoms of MS are also symptoms of a lot of other diseases, and things that they might naturally experience when they become older. But it's definitely something that if someone feels like there are issues, to really advocate to have a proper diagnosis. And, some of the things that what a diagnosis, trying to get that diagnosis, it might include is an MRI to check for lesions in the central nervous system. Uh-huh. They do cerebral spinal fluid analysis, and an EP test, which is an evoked potential test to check nervous system response time. So, people living with MS are suspected of having MS, they may feel hopeless in regards to their disease, especially if they're not getting that proper diagnosis. Because too many times it's like, if I only knew what was going on, if I had an answer to why I feel this way, especially when you're talking about the fatigue. Mm-hmm. MS is chronic, but it's not terminal. So many people with MS can still live productive lives into their 80s, so it's very important to put in that, and we talk about it, put in that safety net of assistance, and make sure with our care partners, and make sure you have the appropriate advocacy, with a care manager coming in and fighting with you for that proper diagnosis.
Yeah, I think that's important too, and especially if the diagnosis is early on in the progressiveness of the disease, it's super important to get those things set up and maybe, hire a care manager to ensure all of your legal and financial documents and everything like that have been reviewed, because like you said, as the disease progresses, and it could take years to do that, but you don't want to wait until it's the point where you're cognitively not able to make any kind of decisions. Correct. And then that power is taken away from you, and the things weren't set up properly. So we always preach that proactiveness, and I think that's important in this case too.
Exactly. I think it's great that they have a special month just to focus on MS.
Absolutely, and the MS color is to wear orange ribbons. Is what the notification is, and there's National MS Day, which I believe is May 30th.
May 30th, yes.
Correct. So National MS Day is May 30th, but the Awareness Month is all month of March. So we wanted to, because like I said, we deal with so many clients that do have this progressive disease, and we wanted to kind of bring awareness to it so people can better understand it. And we'll make sure to put some links and information in our blog as well to get some more information about MS. And, always feel free to reach out to us. You can fill out a contact us form, send us a direct message on Facebook, or leave a comment in the comment section. We'd love to hear your own stories about MS or any of your family members, and what you guys have dealt with, because it helps, I think, everyone understand when that dialogue happens as well. So we hope to see everyone next week. As always, thank you so much, Teresa, and thank you all for joining us. Take care.